Vitiligo is an autoimmune skin condition characterized by the loss of pigment-producing cells. Vitiligo comes in two major varieties, segmental and non-segmental. The vast majority of cases are non-segmental, which is what we're going to be speaking about today. Historically with vitiligo, we've had many challenges with treatment, in part because most of our efforts were centered around the use of topical corticosteroids and topical calcineurin inhibitors. Topical therapies that only have middling efficacy have some issues with long-term safety and oftentimes didn't get our patients where they needed to be in terms of both stopping depigmentation and encouraging repigmentation. However, that's all changed with the arrival of Opzelura. Opzelura, or topical ruxolitinib, is a very different type of treatment than broad-acting immunosuppressive topical therapies. We're going to be reviewing three unique patient stories of vitiligo here today. The first is our patient Lyla, a 12-year-old with new onset vitiligo and family history, who's going to be joined by her mom. Lyla, Kyla, thanks so much for joining me and having a chance to talk all about your journey with vitiligo. Now, I know that you and I have had a chance to get to know each other over a good amount of time when it comes to thinking about your treatment, but I really want to go in the past and think about your story and everywhere you've been and how you got there. Do you mind telling me a little bit about when you first noticed something was happening with your skin that wasn't normal?
When I first noticed it, it wasn't really surprising to me, but I was just kind of shocked when I first saw it because I didn't know it was going to happen.
Yeah.
But it wasn't really surprising to me because my grandma has it, and when I knew that, I was like, well, I got it too.
I wasn't alarmed by it because my mom has it, but I was kind of like, geez, she got it,
Yeah.
you know, sort of thing. But she never really talked about it or had a problem with it. So for the longest, we never really even like sought any treatment until I just asked her one day in the car, like, how do you feel about this? Do you want to try to do something about it? And she's like, yeah, I would. So that's when we, when she was around 8 years old, started like seeking out help with it.
It came up on my legs, and when I was wearing shorts, it was kind of weird, but nobody really said anything about it. But I did want to try it to see what would happen, and then it came up on my arms.
I want to sort of get to that step when you decided to seek treatment. I know you tried some stuff initially with your doctor, and did that really help?
Yeah, we went to the doctor. They gave us two different creams. One was a steroid, and they told us, you have to use it for 2 weeks and then, give it a break and then use it again. And yeah, I didn't see a big, difference in it, not like I've seen with her using the Opzelura.
Yeah, and so maybe we can even get to that step, because it sounds like, if I can recap, the creams you tried, maybe they helped a bit, maybe they weren't making that much of a deal, but the instructions involved a little bit of work, using it for 2 weeks, then kind of stopping, and I'm guessing you probably weren't quite as motivated to even continue with your treatment just because maybe you weren't getting the effects as quickly or as strongly as you wanted.
Yeah, not really. Like sometimes when I would go on like the 2-week break, I would sometimes forget I have to do it. So it wouldn't really have that much of an effect because I kept forgetting to do it after the 2-week-long breaks that I had to take.
Well, let's fast forward to when we got to know each other, and we had the chance to meet each other in my clinic. What do you remember about that discussion we had about Opzelura in terms of why I thought it might be a good option for you, both in terms of it being safe and effective?
So yeah, we came to see you, and I remember like talking to you and feeling comfortable, like we had found like our doctor, like this was gonna be different than the experience that we had before. I had seen the Opzelura commercials and had wondered, like, does this really work? And it just worked. Like I feel like a month, 2, maybe, we started to see those little spots that she had, like right here and here. I mean, you can see they're gone. They're not even there anymore.
I was kind of like eager to know if it would work because my other treatment wasn't working that well, but I was just kind of excited to see if it was actually going to work, and it did.
So maybe take me through kind of your first few months on the therapy, anything you noticed? Do you feel like it was night and day that quickly? How well did you tolerate it? How did you remember to keep using it?
I remember to keep using it because I was using it daily, and it worked really fast. I didn't expect it to work that fast. I thought it was going to take a little while longer, but it ended up working really fast, and when I saw that, I was kind of excited and kind of glad I came to see you.
You are a superstar, and I'm just getting to that next, because what I want to know about is, I know that there's a lot of activities you're involved in, and maybe you felt like the vitiligo was having some kind of effect on them, maybe not. How do you feel now with those areas that were lighter colored, getting more normal color like your skin tone? Does it make you feel more confident? Does it make you feel like you're doing your activities better? What have you noticed?
It makes me feel more confident, and like with confidence, it made me like do the things I do better. Like in cheer, like when I'm on the stage and stuff, I feel less nervous about like people taking pictures and stuff. And like when I'm playing volleyball, I like wear shorts and stuff now. So it made me feel a lot more confident.
Some may say that vitiligo is simply a cosmetic condition and not worthy of consideration as a chronic medical disease. I push back on that. Vitiligo is indeed a chronic autoimmune disease that has immense impact on the lives of our patients, mental, physical, and psychosocial. The effects of living with a visible skin condition are profound, and it's important to consider exactly how this weighs on our patients. No matter the decision you make in terms of pursuing treatment or not, it's important to demonstrate a compassionate and patient-centered approach, which is going to make the biggest difference for your patients.